Well, tonight we are in the Dunkirk Cultural and Arts Centre, which is in the heart of North Belfast. Jerry Kelly and I, without any doubt, would meet people who are struggling with mental health, some of which have lost families through suicide. And I suppose it's one of those issues that really needs, in our opinion, opportunities to create awareness. And see, for us tonight, what we wanted to do was to bring people together to say that mental health and good mental health is our priority, and what we want to do is look at ways in which we can lessen preventable deaths by suicide, try and give better mental health support and provision, and actually support the families and the people who are supporting families around mental health support. And it's really, really good that on a really cold night you have so many people coming out. I mean, we really appreciate the fact that Michelle O'Neill, despite a very, very busy day, she's just come back from another event in the City Hospital, has came to North Belfast because she knows it is a priority. It's a priority for the party. But Michelle, as Minister for Health, has stated very clearly that she wants to be a champion for mental health, and she's here to listen. Everyone knows the sensitivities around, how people feel, particularly in a closed room. They need to be able to have the space and the privacy to talk about those feelings. So we're asking people tonight, it will be respected, not to record the proceedings, because people need to have the space to be completely open and honest. And Michelle's here, I'm here, Jerry Kelly's here to listen to those concerns.
It's brilliant to be here in North Belfast tonight and have the opportunity to engage with a wide range of people. We had families here who've been bereaved by suicide. We had people who work on the front line in the community and voluntary sector, in statutory services. And I asked them to come along tonight and be very frank with me in relation to the challenges which they see in supporting people who are vulnerable and people who have mental health problems. Tonight I found the exchange of views and comments really, really useful in terms of developing a new strategy for suicide prevention for the future. We heard tonight some of the harrowing stories, people's individual experience of how they felt let down by services at times, and how very clearly the message that I got tonight was that there's a need for more joined up working. People need to be working together to deliver services and support those people who are vulnerable. It was a really, really useful meeting. I am absolutely committed to parity of esteem for mental health. There's a legacy of underfunding. There's a legacy of the conflict here. We have higher rates of mental health problems. So I'm committed to making sure we achieve parity of esteem for mental health. That's about giving more attention, directing more resources, and prioritising the work in relation to mental health. I'm going to be very much someone who, and I've said this consistently since I've taken office, I want to listen to those people with lived experience who've tried to access services, and for me tonight that was really what the engagement was about. It was about listening to people's experience and how can we make things better. So I'm committed to making sure we set out a strategy for how we're going to deal with mental health in the future. I'm going to be engaging and listening to people day and daily in relation to their experiences, and that will help me make sure that I develop and make sure we put in place proper services for individuals.